Well, iodine is the most important micronutrient which helps making thyroxine, which is the output of the thyroid gland. And this is so important for the development of the baby, especially the mental development. So I think iodine is one of the most important micronutrients, especially in the first trimester, even later. Magnesium, we use it for treatment if there are too many leg cramps, or if there's something like eclampsia or pre-eclampsia, we give magnesium sulfate to treat it. So you know how important magnesium is, and I think that enough magnesium in the body could prevent all these conditions, especially if the patient is hypertensive. Importance of zinc is being recognized in medical practice over the last few years, especially in the pediatric practice. And now we also know that it is an important component for protein synthesis, nucleic acid metabolism, and also in wound healing, neurological and immune function. Besides, deficiency of zinc in pregnancy has been associated with impaired immunity, prolonged labor, sometimes preterm birth, and also intrauterine growth restriction. It is a very important micronutrient, and even low birth weight could be associated with deficiency of this micronutrient. Well, omega-3 fatty acids are really very critical in building blocks of fetal brain and retina. So consumption of this specific group of fatty acid during pregnancy, either in diet or by supplements, is associated with improved neurological development outcomes in the child. They also play a vital role in determining the length of gestation and in preventing perinatal depressions. Vitamin D is an oil-soluble vitamin, and it is so essential in pregnancy or otherwise in all of us, because this is the vitamin which helps movement of calcium from the blood to bones. And while the baby's bone system or skeletal system is forming, we need a lot of vitamin D there so that the blood can sort of utilize all the calcium towards the bone formation. Not only the mothers restore her calcium, and also the babies. ICMR recommends 400 international units of vitamin D per day. So it is very important to remember that just small amounts of vitamin D are essential for women who don't show a lot of deficiency. However, if there is a lot of deficiency, then just to overcome the deficiency, what we need is 6 lakh units in whichever period time we give it. So 60,000, not on a daily basis, it's best to give it on a bi-weekly or weekly basis depending on the baseline levels. But once we've supplemented 6 lakhs, we have to stop vitamin D supplementation. And after that, what should remain as daily supplementation is just about 6,000 IU. Is not dangerous if the woman is deficient in vitamin D, but it won't supplement so fast. So it's best to give 60,000 together rather than 1,000 IU every day. But then 1,000 IU throughout the pregnancy could lead to a dose which is higher than 6 lakhs. And we all understand that vitamin D can lead to toxicities, especially in the development of the skeletal system of the baby. So giving 1,000 IU could be too much for a woman who doesn't show deficiency but just needs a daily requirement. Vitamin B12 is another important vitamin, known also a micronutrient, which is very essential for formation of red blood cells. Especially if vitamin B12 is deficient, what happens? These are large blood cells which form. Once upon a time, we used to just do a peripheral smear and detect a vitamin B12 deficiency. Nowadays, we have more modern tests. We can do vitamin B levels, B12 levels, and detect deficiencies and supplement.